Are you ready for a jaw-dropping surgery secret? Get this. The person who closes your incision after surgery is often not the same surgeon who performed your operation. Seriously, can you believe it? The surgeon you met before going under anesthesia might not be the one putting in those final stitches. Let's dive in and discover why this happens, and who's actually doing the closing. Are you ready for a jaw-dropping surgery secret? Get this. The person who closes your incision after surgery is often not the same surgeon who performed your operation. Seriously, can you believe it? The surgeon you met before going under anesthesia might not be the one putting in those final stitches. Let's dive in and discover why this happens, and who's actually doing the closing. The person who places your final stitches might not even be the surgeon you met in consultation. Shocking, right? Today we're pulling back the curtain on one of medicine's most mind-blowing secrets. Who actually closes your incisions after surgery, and why this system works even better than you might ever imagine. Get ready to be amazed. Today we're pulling back the curtain on one of medicine's most mind-blowing secrets. Who actually closes your incisions after surgery, and why this system works even better than you might ever imagine. Get ready to be amazed. Thanks to medical dramas and movies, we've all been sold the same story. One brilliant surgeon walks into the operating room, performs miraculous feats, and then personally places every single stitch to close the patient. This makes for great television. But it's not how modern surgery actually works. Real surgery is nothing like what you see on screen. It's not a one-person show. Instead, it's more like a Formula One pit crew, where every person has a specialized role, and timing is everything. The surgeon you consulted with before your procedure? They're absolutely crucial. But they're the team leader, not a solo performer. And just like you wouldn't expect a Formula One driver to also change their own tires during a pit stop, you shouldn't expect your surgeon to handle every single aspect of your operation personally. This team approach isn't cutting corners. It's actually the gold standard of modern medicine, designed to give you the best possible outcome. So who's actually in that operating room with you? Let me break down this incredible team. First, there's your lead surgeon. This is the person you met before surgery, the one with years of specialized training in your particular procedure. They're responsible for the most critical and complex parts of your operation, the moments that require their specific expertise and experience. Then you have assistant surgeons or physician assistants. These aren't junior doctors learning on the job. They're highly trained professionals who've spent years mastering surgical techniques. Many have performed thousands of procedures themselves. You'll also find surgical technologists, often called surgical techs. These specialists know every instrument, every procedure, and can anticipate what the surgeon needs before they even ask for it. Don't forget the surgical nurses, who manage everything from sterile fields to patient monitoring, and your anesthesiology team, who keep you safe and comfortable throughout the entire procedure. Each person on this team has trained for years to master their specific role. It's not about hierarchy, it's about specialization and efficiency. Here's what might surprise you. This division of labor actually makes your surgery safer and more successful than if one person tried to do everything alone. Now here's where things get interesting. While your lead surgeon focuses on the complex, specialized work that only they can do, closing your incision is often handled by other qualified members of the team. This might be a surgical resident who has performed hundreds of closures, a physician assistant with years of suturing experience, or even a nurse practitioner who specializes in wound closure techniques, as well as a surgical first assistant. Before you panic, let me be clear. These aren't random people with basic first aid training. Surgical residents are doctors who've completed medical school and are in advanced specialty training. Physician assistants have master's degrees and extensive clinical experience. These professionals have often closed more wounds than some attending surgeons. The techniques they use for closing your incision, whether it's sutures, staples, or surgical adhesives, follow strict protocols. Every stitch is placed according to precise medical standards that ensure optimal healing, minimal scarring, and the lowest risk of complications. But here's the part that might really surprise you. Research shows that outcomes for wound closure are just as good, and sometimes better, when performed by these specialized team members compared to when the lead surgeon does it personally. Why? Because while your surgeon was focusing on the complex internal work that required their unique expertise, these team members were concentrating specifically on achieving the perfect closure. You might be wondering, shouldn't the surgeon do everything themselves? It's a fair question, but the answer reveals why modern medicine has evolved this way. Think about it this way. Would you want your surgeon to spend 20 minutes carefully placing every single suture when they could be using that time to start saving another patient's life? Or preparing for a more complex case that only they can handle? This system of shared responsibility isn't about cutting costs or taking shortcuts. It's based on decades of research showing that specialized teams produce better outcomes than individual performers trying to do everything alone. Studies from major medical centers consistently show that hospitals with strong team-based approaches have lower infection rates, fewer complications, and faster patient recovery times. When everyone focuses on what they do best, patients benefit. There's another crucial factor: fresh eyes and hands. By the time your surgeon has completed the most demanding part of your operation, they may have been working for hours. Having a team member with fresh focus handle the closure often results in more precise, careful work. The person closing your incision isn't just finishing up. They're performing a critical final step that affects how well you heal, how your scar looks, and how quickly you recover. This collaborative approach also means your surgeon can review your case, plan your post-operative care, or consult with your other doctors while knowing that the closure is being handled expertly by another qualified professional. So what does this mean for you as a patient? First, don't be surprised if you wake up and learn that someone other than your primary surgeon placed your final stitches. This is normal, expected, and actually a sign that you received care at a well-run modern medical facility. Second, you can feel confident that whoever closed your incision was specifically trained and qualified to do so. They weren't learning on the job. They were applying years of expertise to ensure you heal properly. Finally, remember that your lead surgeon was still overseeing everything. They made the critical decisions about your care and ensured that every step met their standards. The next time you, or someone you care about, faces surgery, remember this jaw-dropping truth. Healing is all about teamwork, not solo heroics. Those hidden hands placing your final stitches? They're not just helpers. They're essential partners in your recovery. Isn't that amazing? So the next time you think of surgery, picture a whole team working together for your best outcome, not just one superstar. If this blew your mind, smash that like button, share this with your friends who love wild medical facts, and subscribe for more behind-the-scenes secrets from the OR. Up next, how anesthesiologists keep you safe while you sleep. Trust me, you don't want to miss it.